This story follows Chaco, a dedicated entrepreneur who runs a thriving business in the bustling city of Kochi. But when his life takes an unexpected turn, he finds himself at Kinder Multi-Speciality Hospital. There, he discovers a new appreciation for the compassionate staff who help him on his journey to recovery. But there's more to this story than meets the eye. Join us as the CBI unravels the mystery of the pancreas and uncovers the truth behind Chaco's ordeal.
Mr. Chaco, do you know why you are here?
No, I don't remember anything.
You don't remember running a red light and hitting a pedestrian.
What? No, I didn't kill anyone. I swear, I don't even know who she is.
We have witnesses and CCTV footage that prove otherwise. You killed a lady, Mr. Chaco. You are facing a charge of vehicular manslaughter.
It was an accident. I didn't see her. I was feeling dizzy and confused.
Dizzy and confused. What were you on? Drugs? Alcohol?
No, I have never used drugs or alcohol.
And that's not all. You also robbed a bank and assaulted a store manager in the past few days.
What? No, I didn't do any of those things.
We have evidence for those crimes too, Mr. Chaco. You are in big trouble.
Please, I don't understand what's happening to me.
Maybe you should tell us the truth, Mr. Chaco. Why did you do these things?
I don't know.
Thanks Vikram for coming. We are in deep trouble. You know your cousin Chaco. Vikram, please help me. Chaco is innocent. He is not a criminal.
I know, cousin. I know Chaco very well. He is a law-abiding man.
Then why did he do these things? Why did he kill someone?
I don't know, but there must be some explanation. Some reason behind his actions.
He has been acting differently recently. Sometimes he would feel dizzy and confused. Sometimes he would grab things that were not his. Sometimes he would lash out at me for no reason.
Really? That's strange.
Yes, and he would always sweat and tremble afterwards. Even when the air conditioner was on. Then I would give Pepsi or some juice and then he would be all right.
Sweat and tremble? That sounds like a medical condition.
Do you think so?
Maybe there is something wrong with his health that is affecting his behavior.
Can you find out?
I will try, cousin. I will try to find the truth and save him.
Thanks, cousin.
morning, Big Bang. Good morning, Harry.
So you want us to probe this case?
Yes, sir, please.
Why? This seems like an open and shut case to me. The police have enough evidence to convict him.
But sir, he is my cousin. And he is not a criminal.
How do you know that?
Because I know him, sir. He is a good man. A family man.
And a bad driver, a bank robber and a shoplifter.
No, Harry, he is not any of those things. He is suffering from some medical condition that is making him do these things.
What medical condition?
I don't know yet, but his wife told me that he has been having symptoms like dizziness, confusion, sweating and tremors. And these symptoms will get relieved on having Pepsi or fruit juices.
That does sound unusual.
Maybe he has a brain tumor or something.
Maybe, or maybe something else.
Vikram, this case looks interesting. I will definitely investigate this case and find the truth. What happened here?
Chaco took the gun from me. He was crazy. He shot in air, but didn't take a single penny from the bank.
Yes, he was acting quite strange. He was sweating and shaking a lot.
Was he like that before the incident?
No, he was normal. He just suddenly snapped. He is a regular customer of our bank. He never did such a thing before this. And the best part, he was perfectly normal when I gave him Pepsi.
That's odd. Thank you for your cooperation. So, Chaco, let's start from the beginning. Can you tell me what happened on the day of the incident?
I was driving my car when I suddenly hit a lady who was crossing the road. I panicked and didn't know what to do, so I drove away from the scene. Later, I went to the bank to withdraw some money, but when I was inside, I saw a person with a chocolate bar. I was hungry so wanted to eat it. But police say I fired the gun in air. I don't know what they're telling. I would never fire a gun.
You mistook a gun for a chocolate bar?
Yes, sir. I was confused and didn't know what was going on.
Well, Chaco, let me tell you something. A gun and a chocolate bar are two completely different things. You can't mistake one for the other. And firing a gun is a serious crime. You could have hurt someone or even killed them.
I know, sir. I'm sorry for what I did. I was sweating and trembling. I came to my senses only when I had some Pepsi. I'm not a criminal. Please believe me, sir.
You need to understand, Choco, that there are consequences for your actions. You killed a woman in a car accident and then you went and fired a gun. Vikram has told me about you. And this case seems interesting.
I understand, sir. Thanks.
Good. Cooperate with us. You'll have your chance to explain yourself in court.
I will cooperate, sir.
Hello, Dr. Ravish. This is Setha Ramaya, the CBI detective. I need your help with a case.
Hello, officer. What can I do for you? Sorry for the noise. I am at our hospital's employees get together. Why don't you join us at the party?
No, I am not very good at dancing, thanks. I have a suspect who has killed someone in a fit of rage. He was sweating and trembling before and after the incident. His abnormal behavior would normalize with sweet drinks. Do you have any idea what could cause this?
Sweating and trembling? That sounds like hypoglycemia. That is low blood sugar. It can make people confused and violent.
But he's not a diabetic and not taking any medicines. How can his blood sugar be low?
Well, there is a rare condition called insulinoma. It's a tumor that produces too much insulin. Insulin lowers the blood sugar. Maybe he has that.
Insulinoma? How can we find out?
There is a test called the 72 hours fast test. It's similar to your dummy test, which you did previously in one of your cases. You make him fast for 3 days and measure his blood sugar and insulin when he develops those symptoms of hypoglycemia and violence. If insulin level is high in spite of low sugars, insulinoma is confirmed.
Sir, the prosecution might contend that hypoglycemia can be induced by external insulin injections. What would be our counter-argument?
We are not only testing for insulin but also for C-peptide. C-peptide is released from the pancreas along with insulin, so both levels will be high. C-peptide cannot be injected from outside. This should address your concern.
Thank you, doctor. You may have just solved this case. Vikram, Dr. Ravish is planning for a dummy test on Choco. Ha!
Dummy test? Oh, not again. Hello, Dr. Ravish. I have some questions about insulinoma, a rare type of pancreatic tumor that produces excess insulin.
Sure, Dr. Gokul. What would you like to know?
Well, in Chaco's case we are suspecting he may have an insulinoma. I wanted to know more about it.
I see. Well, insulinoma is indeed a rare condition that affects the beta cells of the pancreas, which normally secrete insulin in response to high blood glucose levels. However, in insulinoma, the tumor cells secrete insulin regardless of the blood glucose levels, causing hypoglycemia and stimulating appetite and weight gain.
How can we confirm the diagnosis of insulinoma?
The diagnosis of insulinoma is based on 3 criteria. First, the presence of symptoms and signs of hypoglycemia. Second, we need to document that blood sugars are low, that is a random blood glucose level at the time of symptoms of less than 45 mg per deciliter. And third, the symptoms should be relieved after administration of glucose. So this proves that all the symptoms was because of low blood sugars. These 3 are known as the Whipple's triad.
I see. And what blood tests should be ordered to measure the insulin levels?
You should measure plasma insulin, C-peptide and proinsulin levels during a 72-hour fast, which is supervised in a hospital setting. Normally, insulin production is suppressed when blood glucose levels are low, but in insulinoma, the insulin levels remains high or inappropriately normal during fasting. An insulin to C-peptide ratio of less than 1 is indicative of insulinoma. A high ratio of proinsulin to insulin may also indicate an insulinoma.
And how can we locate the tumor in the pancreas?
There are several imaging techniques that can help you locate the tumor, such as computed tomography, magnetic resonance imaging, endoscopic ultrasound, or positron emission tomography. However, some tumors may be too small or difficult to detect by these methods. In that case, you may need to perform an invasive procedure called the selective arterial calcium stimulation test, which involves injecting calcium into different arteries supplying the pancreas and measuring the insulin response.
I see. And what is the best treatment option for insulinoma?
The definitive treatment for insulinoma is surgical removal of the tumor, which usually results in complete recovery and cure. Most of the insulinomas, that is 90%, are benign and solitary, but some, that is 10%, may be malignant or multiple, especially in patients with genetic syndromes such as the multiple endocrine neoplasia type 1, MEN1, or the von Hippel-Lindau disease, the VHL. MEN1 constitutes 5% of all insulinomas. In these cases, surgery may not be possible or sufficient, and other treatments such as chemotherapy, radiotherapy, or targeted therapy may be needed.
Thank you very much for your explanation, Dr. Ravish. You have been very helpful.
You are welcome, Dr. Gokul. I'm glad I could assist you.
How are you feeling, Chaco?
Hungry and angry. Why are you doing this to me? I didn't kill anyone.
We're trying to help you, Chaco. We think you have a medical problem that may have caused all your problems. Nurse, please start the 72-hour fasting test.
Yes, doctor, and we are starting now.
Good evening, Dr. Ravish. The 72-hour fast test results have come. RBS was only 16 mg per deciliter. But insulin levels are quite high, 78.9 micro-international units per milliliter. Also there is one more result, C-peptide, which is 2355 picomoles per liter. What does these results mean, sir?
Dr. Gokul, this only confirms the diagnosis of insulinoma. Now we have a patient with very low sugars, that is a random blood sugar of 16 mg%. In that case, we would have expected in a normal person very low insulin levels. But this is quite high, above the normal level, 78 micro-international units per ml. So we have a high insulin level in spite of low sugars. So the hypoglycemia is because of high insulin levels, that is insulinoma. Also the C-peptide levels are quite high, more than 2000. So the insulin to C-peptide ratio is less than 1. So the insulin is not exogenous, it is endogenous because C-peptide is released along with the insulin. And the ratio of less than 1 proves that the cause of recurrent hypoglycemia in this patient is insulinoma. So get an ultrasound abdomen done and an MRI abdomen with contrast.
Sure, sir. I will arrange for that. I am really excited. I can't believe it. The MRI abdomen with contrast test was negative. We still don't know where the insulinoma is. How can we treat this patient if I can't find the source of their hypoglycemia?
Don't lose hope, Dr. Gokul. The MRI is not the only diagnostic tool we have. There are other options such as endoscopic ultrasound, selective arterial calcium stimulation test, or intraoperative ultrasound.
But those are more invasive and risky. And what if they also fail to locate the tumor? This patient has been suffering from recurrent episodes of low blood sugar and confusion for months.
I understand your frustration, Dr. Gokul. But you have to be patient and thorough. Insulinomas are rare and often small tumors that can be hard to detect. Sometimes they can even spread to other organs. We have to exhaust all the possibilities before we proceed to surgery.
You're right, Dr. Ravish. I just got anxious.
It's okay, Dr. Gokul. Take care of yourself.
Thank you, Dr. Ravish. I appreciate your support and guidance.
You are welcome, Dr. Gokul. We are a team after all. We will figure this out together. Mr. Chaco, we have some good news and some bad news for you.
What is it?
The good news is that we have found the cause of your symptoms. You have a rare condition called insulinoma.
Insulinoma?
Yes, it's a tumor in your pancreas that produces too much insulin. Insulin is a hormone that lowers your blood sugar level. When you have too much insulin, your blood glucose levels drops too low. This causes hypoglycemia.
Hypoglycemia?
Yes, it's a state of low blood sugar that affects your brain and body function. It can cause dizziness, confusion, sweating, tremors, and even seizures.
So that's why I did those things?
Yes, Your hypoglycemia impaired your judgment and behavior. You were not in control of yourself. The release of insulin by these tumors is episodic. So you used to have bouts of altered behavior when these insulin levels were high.
Oh God, I can't believe it.
The bad news is that we have not been able to locate the tumor yet. We did an MRI scan, but it was negative.
So what does that mean?
It means that the tumor is very small and hidden somewhere in your pancreas. We need to do another test to find it.
What test?
It's called the endoscopic ultrasound. It's a procedure where we insert a thin tube with a camera and an ultrasound probe through your mouth into your stomach and duodenum. Then we use the ultrasound to scan your pancreas and look for the tumor. For this, you need to be moved to another hospital.
Is it painful?
No, don't worry. We will give you sedation anesthesia. You won't feel anything.
And then what?
And then we will remove the tumor surgically. Once the tumor is gone, your insulin levels will normalize and your symptoms will disappear.
Will I be cured?
Yes, you will be cured.
Thank God. Thank you, doctor.
You are welcome, Mr. Chaco. But we have to act fast. The tumor can grow and cause further symptoms and problems. Some violent behavior again.
Good morning, officers.
Hello, Dr. Ravish.
It was indeed a pleasure working with you.
Thanks, doctor, or else an innocent poor patient would have been punished by law. Tomorrow we will move the court for bail.
Welcome. It's my pleasure. We are very happy that we could help Chaco. Good day, officers.
Sir, why don't you and your team solve the COVID case? It will be a big relief.
Good morning, Dr. Ravish.
Good morning, sir.
Ravish, I heard you have a wonderful case of insulinoma. Why don't you present it at the monthly clinical meet?
Sure, sir. My pleasure.